Sean? We are on. Thank you. Thank you. Well, partly mine as well. I am going to call the meeting to order and ask to begin. Ms. Chaput, has the roll been called?
Yes, everyone's here.
Everyone is in attendance. Thank you. I would now invite any disclosure of pecuniary interest in the general nature thereof. I see none. Now, there are actually two separate minutes to be adopted today. I will address them individually. Can I have a motion on adoption of the minutes of the previous meeting held 1st September 9th, 2020? Councillor Murphy, seconded by Councillor Bennett. Any errors or omissions? I actually just had one question. This would be for Ms. Sheedy. If everyone would turn to the minutes of September 9th. This is on page 3 of the PDF with respect to the long-term care report. And in the third paragraph, beginning with Mrs. Sheedy provided, I note in the fourth line, it says that the staff member was asymptomatic, but with a positive result, agreed to isolate. Agreed seems to be out of place there. Is it not mandatory that a positive result would bring about a self-isolation?
That's correct. Yeah.
Okay, just for our purposes then, I wonder if that might be amended to remove the word agreed and in fact state that with the positive result, the staff member went into self-isolation. Do I need, Mr. Morrow? I don't know that I need a resolution on that amendment. I will then invite the mover and seconder, Councillor Murphy and Councillor Bennett, if you are acknowledged that it might be as amended. Both have indicated affirmative. Anything further on the minutes of September 9th? All in favor? That is carried. Thank you. With that, then, can I have a motion on adoption of the minutes of the meeting held September 30th, 2020? Councillor Love, seconded by Councillor Reguer. Again, any comment, discussion? All in favor? They are carried. Thank you very much. With that, I'm going to go directly into the Emergency Services Department report and ask Chief Nolan if you could please take us through the ES report.
Yeah, thank you, Mr. Chair. Through you to members of the committee, happy to report information item number 1 related to COVID update. I think that it's pretty clear that things have changed from committee meeting to committee meeting over time. I think that item number 1 does outline in detail really where we're at a week ago, and even since a week ago, we continue to provide testing, despite the fact the province has changed the testing requirements. As you'll recall, a month ago, as people were going back to school, we had a significant number of pediatric swabs. They've changed the requirement in terms of staying at home, seeing if you remain symptomatic before coming in for testing, and so on. So that has significantly altered the attendance at a number of our swabbing sites over the past month. The other thing that has changed as part of that process is that the province has changed the funding formula for assessment centers, and they're now going to a dollar value per swab, which then puts an onus on assessment centers to ensure that they're doing an adequate number of swabs per day to be able to justify the expense related to staffing. So this is going to be a significant pressure for us in the coming weeks, especially in some of our more rural assessment center locations, because we need to ensure that there's sustainability in the funding formula to continue to provide swabs in those communities, as opposed to continuing to centralize our swabbing and obligating significant drives where that's even possible for the residents of Renfrew County. So as you can see in the scheduled, we have changed to 7 locations, 5 days a week, and 4 to 6 hours per day within this report. You'll note that even this week we've had to provide less options for scheduling. So while we've maintained the number of communities, we've reduced the frequency within each of the communities so as to reduce the pressures from a financial perspective on staffing. We do continue to provide in-home testing and as well outbreaks support in congregate care and school settings. Long-term care, for the most part, is taking care of themselves and doing an exceptional job of that. So kudos to Shelley and her staff for their ongoing work. We also have Acting Commander Carolyn McGrath working on the communications piece with the health unit and the other partners in the Renfrew County VTAC program to ensure that as the SANS continue to shift from the provincial directives, that we're trying to keep the public as informed as possible as we continue to kind of weave with those changes in direction. Secondly, within item number 1, we did outline our response for assistance that was a call put out by Ontario Health East to assist with drive-through testing at Canadian Tire Centre in Ottawa. So happy to say that our service, along with a number of other services from across Eastern Ontario, assisted in decanting the significant backlog associated with testing in Ottawa. We did put through 2,750 people over a cumulative total of about 13 to 14 hours of testing. And it was an excellent show of support and collaboration that is 100% funded by Ontario Health East. But I think as well, when we look at that, it also raised a number of other issues around lab capacity and other challenges within the system. So times continue to change and we continue to roll with it. But the good news is that out of that experience in Ottawa, Durham, Kawartha Lakes, Haliburton, Hastings, Lanark, Prescott Russell, Ottawa have all since adopted the Renfrew County model of mobile testing. Peterborough has done an exceptional job on their own, and they're using other technologies that they're testing out for the rest of us. So we continue to support one another in those activities. As well, there is a letter attached as ES Appendix 1 for you, which was a very kind letter from Dr. Vera Etches to us, thanking us for our support in Ottawa and assisting in demonstrating that there are other ways of engaging the community, such as the one we demonstrated at Canadian Tire Centre. Item number 2, related to influenza response, we're continuing to work as we have in years past with public health to ensure that shut-ins, community paramedic clients, our staff and their families have ready access to influenza vaccination. As you'll also recall, we did do a seasonal surge program 2 years ago where we engaged the broader community, especially in congregate care. And in many respects, that was foreshadowing to the deployment that we've done during this pandemic. So while influenza is coming back around, we're now waiting for vaccines and the nod to start to engage those populations that are typically more vulnerable. And with that, we're doing refresher education for our staff and collaborating very closely with our partners at Renfrew County District Health Unit. Item number 3, I was very pleased to invite the community paramedic team and the management team from Northumberland Paramedic Service. They've recently launched their community paramedic program and have done it in a model very, very similar to that of our own community paramedic response unit. Interestingly, their program was funded through their Ontario Health team, so they do have one in that area. And as a result, community paramedics is one of their first operational advantages created through their OHT. Item number 4, Mr. Chair, is related to the Sierra team. And I think it's important to note that we've been exceptionally busy in the county with Sierra team calls as well in the interior of the park and in support of our neighbors. With these calls, there's been a record number of people hiking, canoeing, camping, being in the backcountry of the park, and that's resulted in sharp spike in increases in musculoskeletal injuries, drownings, hypothermia, and other things that come with those experiences. And unfortunately, we are called upon on a very frequent basis to be able to support those folks who find themselves in harm's way within the park. I'm exceptionally proud of our Sierra team and paramedics because they've done a fantastic job of integrating within what we would call a mutual aid response, both with the park and our neighboring paramedic services, such as those in Whitney. Without telling all kinds of stories, we did attach a photograph and some additional information related to the CR team and their deployments, because there is a cost, if you will, associated with being an adventure playground, such as the county is and the park is. But in doing that, we've also developed an extraordinary expertise, not only in the clinical care that the paramedics are providing those folks and the interoperability, but also in the risk management approach to what is often a complex situation. Item number 5, related to gratitude, there is an email and some very kind words there related to a CPRU experience. And again, I certainly don't provide an exhaustive list of the thanks that we get. We just try and pick some out to demonstrate the community support for the programs that you're providing and the support that you're providing in the deployment of the paramedic service in its many facets. Item number 6, Mr. Chair, is related to the advanced care paramedic tuition loan. I think it's important to note that this is not new. What happened was that we had a previous agreement with the collective agreement that expired a little under a year ago. And with that expiration, we continue to have our own staff who are seeking to advance their education. And our way of supporting that is to provide a tuition loan that's fully repayable by those individuals over the term of them moving from being a primary care to an advanced care paramedic. So the differential in salary then goes to pay off that loan, which has been a significant advantage. And as you can imagine, the 2 reasons that people tend not to go to school is they either don't have the time or they don't have the money. So this allows them to have the money, but also repay the county. So there are many different schemes out there, ranging from the employer pays 100% of the cost to the employer has no involvement. And I think our approach that has now gone on since 2008 is one that has encouraged many of our staff to have barrier-free access to advancing their education, and of course, thereby increasing the level of service that we're providing within our community. That, Mr. Chair, I believe concludes my report for this morning. Happy to answer any questions.
Thank you very much, Chief Nolan. Committee, we are going to go back to information items and begin, as we always have this last 6 months, with the COVID-19 update. Any questions, comments? Warden Robinson, please.
Thank you very much, Chair. I just want to add to Chief Nolan's comments about the swabbing costs. It is not going to be sustainable for us to continue to be swabbing in the outlying areas unless the funding is there for us. Chief Nolan and Mr. Moore and myself had a conversation yesterday afternoon. I have sent an email and a text to MPP Yakabuski asking him to meet with us again, maybe about 20 minutes on a Zoom call, preferably this week, to discuss exactly how we're going to keep doing this, because the residents in the outlying areas deserve the service that the more populated centers receive as well in the county of Renfrew, but it's not sustainable at $38 a swab. We just can't do it. So I'm hoping that, I'm sure I will get a response from Minister Yakabuski sometime today as well. I'm also interested, Chief Nolan, you're talking about other areas in Eastern Ontario that are adopting the mobile testing model. So I don't need to know now, but that might be helpful information for us as well, knowing who else is out there doing it, because if they're also trying to serve their outlying areas, they're going to be dealing with the same problems that we have as far as funding is concerned. So that's just my comment, Chair. Other than to say, to remind people to reach out to your communities, to ask them to share their stories about VTAC with our Premier. The more we can do that, the better it is for all of us going forward. Thank you very much.
Thank you very much, Warden Robinson. Any further comment, discussion? I had a couple. One of them was what the warden had just broached there, alluded to. Certainly, we became aware, I believe, perhaps at the August council meeting, that the assessment center invoicing, there had been some tardiness in receiving funds. Those funds, as I understand from Chief Nolan, are now flowing. Certainly in the maelstrom that we find ourselves, it is COVID-19. That is not unexpected, that as we're kind of standing up these brand new systems, that perhaps there might be some delinquency. However, having said that, the assessment centers are part of, or the assessments are part of the health system in Ontario. Municipal taxpayers, property taxpayers do not fund the healthcare system. It is untenable to continue down that path. So certainly that conversation with certainly with our representative, Mr. Yakubuski, Minister Yakubuski, is imperative, but also to communicate clearly to the province that we cannot fund those sorts of things from our property tax base. A couple of others, just with respect to the testing itself, Chief. I am quite aware, just bear with me one moment, that the testing has dramatically reduced. Of course, that was due to incredible pressures that were felt early in this month. Just to put some kind of context for committee, I've pulled up some of the clippings that I've taken from the provincial dashboard. On September 30th, there were 41,000 tests completed, which was astonishing, and yet there were 90,000 still outstanding. 1 week later, there were 48,000 tests completed and 58,000 outstanding. And as of Monday of this week, there were 31,000 tests completed and 24,000 outstanding. Clearly, it has the testing regime, the number of tests that are being performed has dramatically declined, certainly warranted in many instances with a focus on symptomatic. Chief, has that been our experience, certainly within the paramedic service in the area served by Renfrew County District Health Unit?
Thank you, Mr. Chair. So our experience has been, over the past 5 days, we've seen a reduction of approximately half, by half, in terms of the number of people that are coming to be swabbed, despite the fact we've maintained the same level as the peak demand. So with every one of these turns, we have to adjust, and there's always a bit of a lag in the adjustment associated with the policy change. And unfortunately, we don't get any heads up on the policy change, so therefore you end up with this gap in staffing to anticipation. Now, I would say the good news, if there's such a thing related to COVID right now, and that is that we don't have the waits on the phone as we did have. We don't have the multiple days of waiting if you're unable to, or if you're able to drive to, a neighboring community, for example, within the county. The bigger issue is, as that surge flushes through the system, as you've identified, what will become the new norm in terms of getting your test results back. And that is what we're watching closely, because of course the policy change was in part to try and flush through those excess to capacity swabs in the system. So we don't yet know what the full extent of that is going to be, or the retooling of the testing process. So again, we're making multiple changes simultaneously, so it's difficult to truly understand which of those changes has had the greatest impact, both to the positive and to the negative.
All right, thank you for that. As I understand, also the parameters surrounding testing have changed in October, that they are much more now in a focus on high risk, symptomatic, and close contact. That I'm assuming has contributed greatly to the substantial decline. Ultimately, not to mince words, something needed to be done on the turnaround times when they had gotten to be 4+ days, rendered contact tracing essentially mythological. There was no basis for it. We have been incredibly fortunate, as I'm sure everyone on this meeting is quite aware. Every day you receive the updates from the District Health Unit, that we have been astonishingly lucky. And early on in this, I didn't use the term luck, but I think that there's a great deal of luck when we have had substantial cases, or at least incidents of cases in congregate, whether it be schools or other, they have been very limited. And I think that that is largely driven by good fortune as opposed to anything else. But certainly the aggressive tracing, contact tracing, is all but impossible when we were seeing those numbers nearing 100,000 pending each day for about a week. So has the parameter been changed, Chief Nolan?
Yes, and the parameter continues to change. I guess, you know, there's certainly luck as a component. I think that there's a heightened sense of awareness of people who have symptoms, and early reporting certainly helps in the downstream effect. But the other challenges that are out there is that we're seeing, especially in large urban public health units, they're no longer doing contact tracing outside of congregate care or vulnerable populations. So we're starting to drive into what I would call a bit of a black hole of, we don't know what we don't want to know. And I think that that's a challenge from an epidemiologic perspective in terms of being able to truly quantify. So you may have seen some comments in the media yesterday about a plateau in cases. Again, try not to look at the star, try and look for the constellation to figure out where we are. And right now, in the last 14 days, we've had a shift towards pharmacies in communities that are fortunate enough for them to be doing that testing. That testing is being processed outside of the IRLA and public health labs. It's being done at private labs in the United States. So whether that is in those numbers or not, I don't know. Whether the positivity rate and the presumed cases are being reflected the same, we don't know, because many health units are no longer doing contact tracing, again, outside of those vulnerable populations in congregate care settings. So what might have been a presumed case based upon the multitude of phone calls in the contact tracing are no longer reflected within that data. And then I think lastly, I think we're starting to see things that we're looking for and starting to miss the things that we need to be watching for. And that is, you know, what is the true presence of COVID in our community? What is its impact? School now post-Thanksgiving and soon moving into Halloween or Remembrance. So because we have somewhere between 11 and 22-day lag between policy decisions and then actualizing the effect, we are quite literally, I think, blind in terms of where we're finding success and where we're finding failure. And I don't think that that can be truly reflected within the data on a day-to-day basis.
Thank you for that. And I do note, Councillor Murphy, I will come to you in a moment. I do note that probably everyone again on this call is certainly familiar in a rural setting with closing the stable door after the horse is out, is that responding in the aftermath is very much less efficient. The other thing that I would certainly suggest as we were ramping up, or as perhaps the continent, but certainly within Canada, was seeing more increase in number of positive cases in September. There was a great deal of chatter on, well, of course, if you're testing more, you're going to find more. That was misplaced at the time that it was happening. And I think it's underscored how misplaced it is, because as the testing has ramped down, it is small comfort that we may have plateaued if we are testing considerably less people and it is plateauing. I think that does not give me pause for celebration at this instance. Councillor Murphy, please.
Thank you, Mr. Chair. I recognize that this is not a Board of Health meeting, but since we've landed here, I think it's important for the board to direct the health unit in some fashion to not use Renfrew an area, Pembroke an area. You know, I recognize that Cobden and Eganville are part of Pembroke's numbers. But what it says to our residents is that we don't have any active cases in Bonnechere Valley, which obviously we know is not true. You know, yesterday a child tested positive at EDPS. I think that each township needs to know what their numbers are. So I don't know, Mr. Chair, if you need a a formal letter to the Board of Health, or if this is something that you can take back as an ask. But I think that all of our communities should know how many cases are in our direct township. And I'm sure that Kathy would agree with me that Cobden being included and Bonnechere Valley being included in those numbers, that's false economy and very frustrating. And I feel like when people don't think that there are cases in our communities, that's when people get lax. So I'm not sure, sorry, I'm taking up Chief Nolan's time here, but I'm just wondering, how do we go about this?
Thank you for that, Councillor Murphy. Certainly at the end of this month, there is a Board of Health meeting, and I will convey that. I certainly, I'm presuming at the outset this likely was predicated on the acute care, on the hospital models, because I think that's pretty much describes where each of the reports are. And likewise, I have to presume that Douglas is likely in Renfrew, but I'm presuming that part of my community that is near Mixburg may very well be Pembroke. What I would say, certainly for anyone in the area served by Renfrew County District Health Unit, is you're deluded if you don't think it's in your communities. It is everywhere, wherever it's reporting these cases. I think you are perhaps giving yourself a false sense of security if you don't think you're exposed, because it's everywhere. And I'll repeat what I'd said. I believe that there is a great deal of fortune, good fortune, that has prevented us from having substantial outbreaks that have taken us completely sideways. I will certainly draw to committee's attention. You probably are paying rapt attention each day at noon as the numbers are posted. We now have had 15 cases in the month of October. We have only had 14 days in the month of October. At this rate, the month of October has the potential to be the single largest month. So it's everywhere, but certainly I will take that comment to the Board of Health, Councillor Murphy. Warden Robinson, please.
Thank you very much, Chair. And we will be having an Emergency Operations Committee meeting on Monday. We can certainly give Dr. Cushman the heads up at that point as well, that it's something that our municipalities are asking for. I am going to have to leave the meeting for maybe 2 or 3 minutes. So if you can just indulge me here. Through you to Mr. Morrow, do we need direction from committee for me to write a letter to the Premier, to Minister Elliott, and gang about the funding issue that we're having around the testing sites?
Thank you, Warden, or thank you, Warden, through the chair. Back to you. Chair, I think it would be appropriate that committee provides that direction to the Warden, and it can be left at the committee level, and just that the Health Committee directs the Warden to prepare a letter with respect to the funding concerns for swabbing, and with a copy to the Premier and MPP Yakabuski.
All right, thank you, Warden Robinson. Follow up.
Thank you very much. And normally we would be making this recommendation to County Council. However, I don't think we can wait till the end of the month and continue to subsidize the province with our swabbing. So I sooner rather than later. So thank you very much for that, and I will be back in a couple of minutes.
I agree with the Warden's comments. We are, in fact, as everyone is aware, in COVID time, and each day is about 3 months. So given that we are looking at another 16 days to the end of the month, that's intolerable. Mr. Morrow, so just what you had suggested, I do not believe you are recommending that we pass a resolution giving that direction. Is it just by consensus, or should this appropriately be a resolution directing that a letter be written?
Chair, I'd like it as a resolution from committee directing the Warden to prepare the letter. That way we can provide that same direction and inform County Council that that direction was provided and that there was a vote on it at the committee level. I think that would close the loop to County Council. Thank you, Chair.
Very well. Could I prevail upon you then, Mr. Moore, to please reread, or perhaps that was off the top of your head, see if you can match it 100% of what you said.
Let's see what I can do. That the Health Committee directs the Warden to prepare a letter to the Minister of Health with respect to the funding concerns associated with swabbing within the County of Renfrew and our rural communities. And further that the letter be copied to the Premier and MPP Yakabuski.
All right, thank you. I believe that that's very comprehensive. Can I have a mover, please? Councillor Grills, seconded by Councillor Love. Any further discussion or comments? All in favor? That is carried. Thank you, committee. With that, Chief Nolan.
Thank you, Mr. Chair. Maybe if I could just try to put a bit of a point to that issue, because I absolutely appreciate the direction from committee on that item. You know, the consequence in a very real operational way is that if at $38 a swab multiplied by the number of people that show up to be swabbed is equal to or greater than what our cost for operating the VTAC is for that activity, then we have a sustainable model. The challenge right now is that neither Deep River, Barry's Bay, Eganville, and in some cases Arnprior have adequate sustainability to fund the presence of an assessment center in those communities. So you can see the obvious political consequence and very practical clinical consequence to us not having a sustainable funding model, which was arbitrarily decided by the province as to what the remuneration would be. And that's why I'm trying to be very clear as to the consequence to this policy directive and why it's so important that Minister Yakabuski and yourselves are aware that if something doesn't change from a funding model perspective, that we will have to cease operations in those communities, and that would be an absolute tragedy in my opinion. So that's what we're trying to avoid here, and that's the consequence to this policy decision that is a clear disadvantage to rural population.
Thank you very much for that, Chief Nolan, and it is not dissimilar from our pre-COVID experiences in the failure to recognize the vast distances that we have here in rural Ontario typically. If I could summarize, essentially it is the unit cost or the piecework approach that the province has now with this demands a certain throughput for it to be cost recovery. So in this instance, it's untenable with the volumes that we're seeing in some of the perhaps less densely populated regions. So it's unacceptable, certainly to our community, rural Ontario generally, but certainly to our community. So I think that would be an essential part of the correspondence. Thank you for that. Anything further then? We are still, by the way, on number one. Anything further finally on number one? Councillor Doncaster.
Thank you, Mr. Chair. Just curious, or would request that a copy of that letter be sent to the local municipalities.
I think that's appropriate, Mr. Morrow. Yeah. One more time, committee, anything further on item number one? All right, thank you. Moving on to item number two, the 2020 influenza response. I see none. Just one comment that I have to the chief. Certainly the focused rollout to particularly vulnerable populations or those more at high risk perhaps is definitely appropriate. However, I have seen a lot of chatter on social media with respect to the vaccination clinics that are being held at pharmacies and questioning why it's not yet available at your typical healthcare provider. Is that still our experience, or is that beginning to change? Is the vaccine itself being distributed more broadly across the healthcare sector?
I will say, through you, Mr. Chair, from my perspective, and I think Councillor Murphy rightly pointed out that this is not a Board of Health meeting, so they may be in a better position to answer what that strategy is. But I would say that it appears that the pharmacies have certainly had an advantage, but also, and maybe Shelley can speak to it in terms of the long-term care experience and the availability of vaccines in that sector. We are, experiencing some, I'll call it a bit of a distraction around the double dose or the high dose availability versus the standard dose. But it does appear as though there are sectors who have greater advantage to make product available over other sectors. And we have not yet realized a full availability of vaccines to go with a full public campaign.
All right, thank you. Perhaps Ms. Sheedy, you can add some light to that.
Sure. Thank you, Mr. Chair. Through you, excuse me, to committee. Yes, the long-term care homes were required to submit their numbers for residents and staff some time ago, and we've received our supply for the 20/21 influenza year and have started the immunization of our staff. Residents, generally, we don't start until November because the efficacy is only about 3 months. Thank you.
All right, thank you. So certainly I take some comfort in the fact that it is being rolled out to long-term care, and that is perhaps where there is the most significant impact to the county of Renfrew. So thank you for that, Ms. Sheedy. Anything further, committee, on item number 2? Item number 3, community paramedic sharing of knowledge. Warden Robinson, thanks. Good to have you back.
Good to be back. Through you to Chief Nolan, you mentioned that Northumberland has their OHT. Now, the community paramedics Northumberland come under the OHT there. What's the funding model? Is it 100% funded, or is it a municipal provincial split?
No, it's 100% funded through the OHT. For the activities of the community paramedics as it pertains to the OHT, I do believe that that municipality has also funded some community paramedic activity on their own, but that's not necessarily in tandem with the OHT movement. So what they've done is they've modeled their program after ours and have since come back now that they've staffed up to give those paramedics an opportunity. But strictly to the funding, the community paramedic activity within the OHT is 100% OHT funded. And it's based on our model, which actually bodes well for us, in that the most recent approval for an OHT operational model is that which is modeled after our CPRU program.
Thank you very much for that.
Right.
If I could also, Mr. Chair, the warden had made a comment about the list of paramedic services that are also providing a program in a likeness of ours, and those are further up on page 4 in the second paragraph, where those paramedic services that attended the Canadian Tire Center were the ones that went home and replicated our model.
All right, thank you very much for that, Chief. I think it is certainly incredibly valuable to every community across the province, the country for that matter, to recognize the utility, the nimbleness, the adaptability of community paramedicine. I think that certainly the community paramedic model is also the framework. There are so many disparate elements. Once again, that Swiss Army knife, whether it be the corkscrew or the Phillips screwdriver, that is certainly deployable through the community paramedicine structure and framework. So very glad to see this, and I think that likewise, Warden Robinson, certainly allies of the Eastern Ontario Wardens Caucus with respect to the incredible value that's derived from community paramedicine. And of course, once again, any of those elements that are going to be part of the healthcare system need to be funded at 100% from the province. Finally, anything further on 3? Item 4, the Sierra team update. Just a brief comment. I know that it has been an incredible year for the Sierra team this year, and as the chief has certainly acknowledged, part of the promotion and the marketing of the Ottawa Valley, Renfrew County, is our incredible supernatural wilderness and wonderland but of course, it is not a park in an urban setting. It is still wilderness, even though it is in the nearby wilderness. And unfortunately, I'm assuming that the Sierra team was also probably involved in the tragedy on Monday in Algonquin Park. So just taking this opportunity to strongly encourage all of those folks who have found their travel options severely constrained in 2020 and likely to continue for some time to treat nature appropriately. She is a very demanding individual entity, shall we say. Anyway, anything further on the Sierra team update? The items of gratitude. Councillor Murphy, please.
A comment through you, Chair, to Chief Nolan. I love the handwritten letter. That's so cute.
It certainly pulls at the heartstrings, so thank you. Yep.
Item number 5, going twice, going 3 times. Item 6, the advanced care paramedic tuition loan. Can I have a mover, please? Councillor Grill, seconded by Councillor Regier. Comment. I think this is an outstanding initiative. Just as the chief had recognized, the 2 main constraints are both time and money. That I think it is an incredible value that's returned not just to the individual paramedic, but also to the county of Renfrew, and much more broadly, inclusive of course of the city of Pembroke, but also much more broadly to the residents here in our community. All in favor? That is carried. Thank you. I believe that concludes. Can I have a motion to adopt the emergency services report then, please? Councillor Murphy, seconded by Councillor Lafreniere. Once more, any further comment, discussion on any item? All in favor? That is carried. Thank you very much. Thank you, Chief. Ms. Sheedy, if you wouldn't mind now taking us to the long-term care report.
Thank you very much, Mr. Chair. The Health Committee report starts on page 11 of your package. Items number 1 and 2 are the resident statistics as of the end of September 2020 for each of Bonnechere Manor and Miramichi Lodge. Item number 3 is the current status of the wait list as of the end of August 2020. And as consistent with the last 7 months, I guess, item number 4 is an update with respect to the pandemic and long-term care. So I will start with the current status at the homes. So as of this morning, Bonnechere Manor has 4 resident swabs that we're waiting on results. One of those is a symptomatic resident. So that puts us into suspect outbreak, as you will recall. We also are re-swabbing a resident who's returned from the hospital, as well as 2 new admissions. At Miramichi Lodge, we have 1 hospital readmission swab. In terms of staff, you know that we are surveillance testing our staff twice a month. So we always have a large number of swabs outstanding as a result of that. Currently 95 at Bonnechere Manor and 151 at Miramichi Lodge. Within those numbers, though, there are 3 symptomatic staff at Miramichi Lodge and 4 symptomatic staff at Bonnechere Manor. Which means that the lodge as well is considered in suspect outbreak as a result of the staff that are self-isolating at home. Going on or continuing back with the report itself, we have mentioned, noted regularly at these meetings, the delay that we're experiencing, and Chief Nolan has reiterated that as well. Currently, the time fluctuates, the turnaround time anywhere between 4 to 8 days. What is different than, I'll say, preschool starting is that if we had any suspect cases, we get an outbreak number from the health unit, and that we usually tended historically to get those results back quicker. We're not seeing that anymore, so there doesn't seem to be any rhyme or reason. And I think that is because the swabs are going all over the province, that, you know, sometimes we'll get a surveillance swab back before we would get a suspect swab back. So that continues to be an issue. In terms of our preparedness, I did provide to you last month the summary report we did for each of the homes to Ontario Health East in terms of our current status. The government had promised we'd get some sort of a response back from that. The initial response that we got back from Deputy Minister Steele, which is attached as Appendix 1 on page 23 of your package, you can read, but basically it states that it puts the responsibility back on the homes and not of the homes. So there's a typo in the report. To make sure, especially as it relates to staffing, that we have sufficient staffing resources, which of course, as committee knows, is easier said than done. In terms of other points that, well, perhaps, sorry, I'll go on to the also at the bottom, or sorry, the top bullet point on page 13 also speaks to a letter that Advantage Ontario has sent to the ministry, and that's on page 26 of your package. They overviewed a number of concerns as well. And so just to touch on them in terms of the infection prevention and control program, you will recall that our local health unit has inspected each of our homes twice since COVID started, and there are no concerns with either of the Ipac programs at either of our homes. So we're in very good standing there. In terms of emergency plans, you know, as a municipal home, we've had an emergency plan for, you know, more than 25 years. It's reviewed annually. We dusted it off at the beginning of the pandemic, as in addition to our business continuity plan. And we've continued to relook at it and make sure that it is up to date. We are always required to have a staffing plan that remains in place. And in terms of, you know, as I said before, the staffing, the government's been very clear in saying that the staffing is ultimately the responsibility of the licensee. And of course, we know that hospital resources are not likely going to be available to us. Then, as I mentioned, the letter that starts on page 26, and then there was a subsequent letter on page 30 that Advantage Ontario was part of, in addition to a number of other organizations. And it raises a number of points as well, particularly related to the older homes that still have the 3 and 4 bed wards. Of course, the 2 homes that you operate do not have that. The biggest rooms are semi-private, where they share a bathroom, but have more of a private sleeping area. And so that brings me to the funding that was announced on September 29th. And I'll start with the bottom bullet on the bottom of page 13, and I will advise you what I know as of this morning. In some cases, there are still details yet to come. So we do have a further update in terms of the what they're calling the emergency prevention and containment funding. We did get an allotment dated at the end of August. It's on the top of page 14, and then another one on September the 20th. And you'll note it is on a per bed basis as a flat rate, and then an additional amount of funding if your home has experienced an outbreak at any time. So you will recall that both homes have had a staff positive case, which is considered an outbreak. The next bullet point speaks to Ipac capital support. So these are details that I just received today, and I will put them in writing for our next report. But again, it is on a per bed basis, but there's also an adjustment whether the home is an A home, so a newer home like your two county, Renfrew and City of Pembroke homes will receive less funding than would a B, C, and D, an older home. And so I can tell you that as a result of the IPAC funding, thought I had that at my fingertips, yes. Bonnechere Manor will receive 95,720. Miramichi Lodge will receive $92,164. The funding itself, it can include, but is not limited to, any kind of renovations or support to facilitate physical distancing. So just to give you an example, we purchased plexiglass dividers at all of our resident dining tables, anywhere where there's staff screening, and as well as overbed tables for the resident rooms for those residents. While they're suspect, they have to be isolated. They're not able to go to the dining room. So we'll have no trouble spending any of that money. We don't have to apply for it per se, but it is reconciled with the ministry at the end of the year. Okay, and then moving on to the next bullet point, it speaks about support for those homes that have been directed to stop admissions to the 3 and 4 bedrooms. Of course, again, that doesn't apply to our 2 homes. There is $30 million in IPAC resources. This is a case where I don't have any further information at this time. The breakdown we're being told is $20 million for additional personnel. Certainly, the concern has been raised that there isn't funding for a designated IPAC practitioner within each home. To give you an example, for our 2 homes, one of the resident care coordinators, this is part of her portfolio, in addition to responsibility for approximately half of the residents and their families and the staff that are associated with them. And so what organizations like Advantage Ontario have been lobbying for is a designated standalone position, certainly for bigger homes such as ours. So whether that will come to be, I don't know. And then there's also an additional $10 million to fund training for both new and existing staff. And again, we haven't seen any further details on that. The last part within that bullet point speaks to the cost of 8 weeks of PPE. We have been told by the ministry that they will actually coordinate the supply of that as well as the funding. And as recently as last week, I've been informed that that will include N95 masks. However, the provincial stockpile is limited to 2 or 3 brands, and likely not the brands that we had fit tested our staff to pre-COVID. So it will probably require most homes to start the fit testing process again, but nevertheless, we will be very happy to have those on site. The next bullet point speaks to the High Wage Transition Fund, and this is one this committee will be very familiar with. As you have written several letters to the government about this, you will recall that it was initially supposed to end in March of this year. We got to stay until December of this calendar year, and now as a result of COVID, the government is indicating it will be extended until the end of their fiscal year, which is March 31st, 2021. The next bullet point speaks to recruitment and retention of healthcare workers. The first one is broken down into PSW training funds. I have no more information other than what's in the report on that. The second one is the return to service. We were given 1 day's heads up on this. It was announced on September 28th, and we had to apply by October 5th. So a week's turnaround time, many homes not able to take advantage of it. So what it is a $5,000 incentive for a PSW that graduated in April of 2020 or later to apply to a long-term care home and stay for 6 months. They get one installment on hire and then the final installment at the end of that 6-month period. We are hopeful, based on pressure from Advantage Ontario, that they will have additional intakes for this. The next one speaks to supportive care workers for home support, so not applicable to our homes. The next one speaks to accelerated PSW training. We don't have any further information on this. Of course, the program that we run at Bonashire Manor is already an accelerated program. The next one speaks to nursing graduate, where if you had a full-time position, it looks like the government would cover the salary and benefits. We fortunately don't have vacancies in our RNs category very often, so it's not something we've been able to take advantage of to date, but we'll continue to keep that in mind. And then it also speaks to additional funding for nurses across the province for the health system. So I have to think that includes the previously announced public health nurses to go into the schools, etc. And then the last bullet point speaks to support for frontline workers, families, and caregivers. Nothing, it doesn't look like there's anything specific for long-term care there. So, Mr. Chair, I'll move on to the next bullet point, which is the testing in pharmacies. As we know, to date, there are no pharmacies that have been approved in Renfrew County. But we are very thankful that COVID continues to facilitate the testing of our family visitors to long-term care. Did I say COVID? I meant VTAC. The VTAC continues to do this testing. An update on the commission under this topic as it pertains specifically to COVID. There's a link there with more details on it, as well as the individual presentations as they have occurred. If you have time, they're very interesting. I would highly encourage you to check out that link. And then the next, almost last bullet point under this one speaks to new information that was posted on the US CDC committee. May recall this was on their website, taken down, and now is back on again. But of concern is an indication that the science is now saying that COVID can be spread, although much less likely through droplet and close contact than airborne, but probably not coincidental timing with the PPE and the N95 masks that the government is making available to long-term care homes. Continues to stand that should any healthcare worker, upon a risk assessment, a point of care assessment completed on a resident, feel that they need an N95 over and above the aerosolized procedures, the organization is responsible to provide one. To date, we have sufficient stock on site for the aerosolized procedures. There's information on the updated visitor policy. I won't spend a lot of time on this because we do have an addendum that is specific to Renfrew County. And finally, influenza vaccines, as I noted earlier, very happy to say they are on site and we've started our clinics.
If I might, actually, I think, Ms. Sheedy, Mr. Moore, I'm going to step outside of typical protocol, because the world we inhabit now is, I think we now have a 6-page COVID-19. If you go back to March, it was probably 2 paragraphs. So I think that certainly underscores the trajectory of COVID-19, but to keep, while it's still fresh in everyone's mind, I think we'll go back and review the COVID-19 report unto itself. So with that, just bear with me. I'm scrolling mightily here. Anything on the symptoms and surveillance testing committee? Councillor Murphy, please.
Just a comment, Mr. Chair, 4 to 8 days is unacceptable.
Thank you for that. I am in absolute agreement with that, and more so that it's unacceptable is, in my estimation, it continues to demonstrate that we're continually fighting a rearguard action, that we've been on the defensive since March, and we continue to be on the defensive. And until such time as we can get our results in a timely fashion and begin the appropriate contact tracing rather than self-serve contact tracing, then our hands are significantly tied. Anything further on the long-term care testing? Councillor Murphy, once again.
Sorry, breaking news, it's 10:30. There are 721 new cases in Ontario.
All right, thank you for that daily update. And again, we are finding 700 cases, which, by the way, still outpaces anything that was found in the first wave of COVID, is vastly exceeding what the worst days are. It certainly is, I suppose, some fleeting comfort that it is no longer nearing 1,000. But given, as I had indicated in the ES report, that the number of swabs being undertaken each day, I think could perhaps skew, at the very least, in one's mind of what the real impact of this is. Anyway, thank you very much for that update from today, Councillor Murphy. One more time, anything further on the symptom and surveillance testing? Thank you. Moving on, the long-term care preparedness assessment. I just wanted to, I threw a few statistics down here. I forwarded them to Ms. Sheedy yesterday. These are from the dashboard that the province has. And just to give you some again, direction on what the trajectory has been since September 1st. Bearing in mind, of course, the overall impact that long-term care residents account for about 10.7% of cases in Ontario, yet account for 65.25% of the deaths due to COVID. So once again, the province certainly rightly identified the need for an iron curtain surrounding our long-term care homes, but it is long past due that we move past just setting the footings in place for that iron curtain and begin to erect it. But just on September 1st, there were 13 long-term care homes in outbreak, and there was one active case of positive residents on September 1st. On October 1st, there were 44 long-term care homes in outbreak with 96 active cases of positive residents. And October 10th, there were 58 long-term care homes in outbreak and 146 active cases of positive residences. So lest anyone be suffering under misinformation, it is advancing once again in long-term care homes. So I think as the County of Renfrew and City of Pembroke, we're certainly out in front on taking appropriate measures to protect both staff and residents of long-term care. Keep in mind that the numbers are certainly giving us pause on what we may have to do once again. Anything further? Anything on the funding change, the funding announcements? I guess I'll begin in order of the $405 million additional emergency fund. Just a question for Ms. Sheedy. So the two charts are identical, but is the second chart indicative of a second amount of funding that is precisely the same as the first that was received?
Yes, Mr. Chair, received the first one. The funding is effective as of August 31st. So it's basically for the month of August. And the next one we received September 20th, a little bit earlier than has been historical with these monthly allocations, but I suspect related to the ramp up of these positive cases.
Is it anticipated that that's going to be a standing envelope, or these have, even though it has now been rolled out twice, are these considered one-time funding?
So we have been receiving them since March. You may recall in March, every home across the province received 35, I think it was 34,500 in March, and again in April. And then in May, they moved to this system. that is, allocated dependent upon your number of beds as well as whether you've had an outbreak or not. So we've had them each month, but they keep saying that they're one time. So, whether that 405 million includes till the end of December, I don't know.
All right, thank you. I am suffering some technical difficulties. Please bear with me. My second screen has just gone black on me. So I am trying to retrieve my agenda. Just bear with me. This is definitely going to take me a moment.
So we're on the bottom of page 14.
Yeah, I have no page 14 in front of me. That is the
Okay.
situation that I find myself right now.
That bullet point was regarding the Ipac capital support.
Maybe
Okay.
for a washroom break.
No, I just, I have it here now. You'd said we were on page 14, Ms. Sheedy, is that correct?
Yes.
Okay, I have it back on my other monitor. So, yeah, the Ipac funding. Any questions, comments, discussion? Again, the only comment that I want to have, if we can distill, I think the two greatest impacts or impactful things for long-term care homes in phase 2, having had that education in phase 1, it is Ipac and staffing. If there are two things to focus on, those are the two things. And I certainly, with respect to the Ipac at the very least, and I'd call upon even the discussion we had at the time of the audit, perhaps committee might remember when we receive our audit report, the long-term care homes are cited under expenditures under social services, and that is, we were informed that that is typically how they are recorded through FIR. And it may seem perhaps trite, it does not to me. I think that it is long past time to recognize, as the acuity has dramatically increased in long-term care, as I think, I stand to be corrected, but I think something on the order of 80% of residents on admission now have some element of dementia associated with their comorbidities. It's long past time to recognize long-term care as part of the healthcare continuum as opposed to a social service. Perhaps it never was appropriate to recognize them as a social service, but it is certainly anachronistic any longer. But I think that that might be one of the impediments to adequately funding and staffing long-term care, has been how it has been viewed. The next item, supporting occupancy reduction. Again, that doesn't apply to us. Once again, the Ipac resources. Sorry, this is enormously difficult. I'm both trying to keep an eye on committee for questions, comments, and trying to keep an eye on this all on one screen now. The High Wage Transition Fund, questions, comments? Again, both this and the structural compliance were two funding envelopes that were announced as being ending. I believe that was in 2019. Pressure was brought to bear certainly on the province, and they were reinstated. And I think it underscores the dynamic that we find ourselves in COVID. It has become very tenuous at best to continue to consider the ending of these programs. The 52 million for recruitment and retention. Once again, I think that identifies the other second principal challenge with respect to staffing. Additional, I'm not going to go through any of the individual bullets. Anything on the recruitment and retention funding envelope unto itself? I see none. The testing in pharmacies, as I understand, there are none yet in Renfrew County. Perhaps that may change. The update on the COVID-19 Commission. COVID-19 transmission. I think it's important to understand, again, some of the chatter on social media would suggest that the experts in epidemiology and infectious disease are flip-flopping, when in fact it's accurate to say that as the evidence changes, the guidance and advice has to change along with that. And we are an incredibly dynamic environment we find ourselves, even with respect to what we know about COVID-19 and its transmission. And again, underscoring what I had said at the outset of the meeting, that I think that good fortune does have some bearing on the incidence of transmission in a community. Anything on the updated visitor policy? And finally, on the influenza vaccine. Oh, sorry, I do see now you've become a much smaller circle, Councillor Murphy.
Thank you. Sorry, going back to the transmission. I think the other misconception out there is that once you have contracted COVID and resolved, that you can't get it again. And that's a very scary rumor out there, when we know that some people have now contracted it 6 months after having it the first time. So your antibodies only last a certain amount of time. And I think that's a very important note.
Thank you for that, and I certainly acknowledge that I am absolutely no expert on this, but have read quite a considerable amount on that because it has come to light recently. I believe there was an individual in Nevada, if I'm correct. But in reading several different articles, I think that worldwide health entities have suggested that at this point they're only aware of, I think, half a dozen credible instances of reinfection. So certainly it is real, but I think it's important to keep in mind what that is, and that the information, even on something like that, is changing on a daily basis. Thank you for that, though, Councillor Murphy. Anything further on transmission? On the updated visitor policy? And on the influenza vaccines? I see nothing. Ms. Sheedy, if you could carry on then to item number 5, please.
Thank you very much, Mr. Chair. So we're on page 18 of your package. Item number 5, this could very well have been placed under the COVID review as well. The government, as you know, we had pandemic pay for all frontline staff that ended mid-August. The government announced on October 1st that they were going to temporarily increase the PSW wage, regardless of what it currently is, because as you can anticipate, there would be quite a wide range across the different types of long-term care ownership across the province. But nonetheless, it is increased to $3. It is increased by $3 per hour. Again, that's effective October the 1st, and they say that they will continue to regularly review this, and it perhaps will be extended until March 31st, 2021. Now moving on to non-COVID related items. Number 6 is the national standards for long-term care. Would be ideal to see long-term care as articulated in Appendix 4 on page 34 in your package as part of healthcare recognized by the federal government, and appropriate funding to the provinces as a result. Item number 7 is a new operating model for Ontario Health. It's found Appendix 5, page 36 of your package. Item number 8 is streamlined long-term care home inspection reports. It's on page 42 or appendix number 6 in your package. We have not received any of these new formatted versions yet, so we'll be anxious to see what they look like in a practical view. Item number 9, Advantage Ontario, as they typically do, provide a pre-budget submission to the government, and it is found on page 43 of your package. I won't go through it in its entirety. Many of the recommendations mirror things, requests rather, that we have asked for from the government at various times, and most recently in our submission at the AMO delegation with Minister Fullerton. So I think I'll just leave it at that. Item number 10 is appendix number 8, and that's on page 53 of your package. It's a resolution from the Township of North Glengarry where they regarding funding to increase full-time positions as well as inspections in long-term care homes. Item number 11 is a nice piece we thought you'd be interested in, of a physically distanced picture of one of the residents at Bonnashire Manor, a veteran, receiving a very appreciated 50-year pin from the Royal Canadian Legion. Item number 12 is an update on fundraising. The Butterfly Garden continues to be in play. If anybody's interested, or if you know of anyone who is, the virtual coffee house, we rescheduled it to Friday, November 20th. It conflicted with the Pembroke Regional Hospital, a similar event that's happening in October. And finally, the Miramichi Lodge Foundation was notified of a $1,000 donation on behalf of what is called the Bruce and Lucy Wolfgram Foundation. It's not something we applied for, and so we were very happy to receive that. Moving on to resolutions, Mr. Chair, item number 13, which is on page 21 of your package. I'll read the recommendation that the Health Committee recommend to County Council that the approximately $50,000 in savings in the parking lot repair capital budget at Bonnashire Manor be used to replace the required but unbudgeted cook line equipment replacement, which includes 6-burner stove and oven, a 2-burner flat top grill oven and deep fryer, estimated at $40,000, and that the Finance and Admin Committee be so advised. So the background on this is that we definitely knew the equipment, kitchen equipment was aging. The plan was to put it in the 2021 capital plan. However, it has broken down beyond repair and in fact been red tagged such that we're not able to use it. At the same time, we did have the paving lot repairs approved by you through our capital asset program. It was budgeted at $100,000. It was an amount that was placed in there at the very beginning of the program by a previous personnel. The current personnel did look at it, didn't think it was that far off. However, we know because of the cost of gas, et cetera, the cost of paving has come down substantially this year. So we do have that amount of savings available. Did you want me to stop there, Mr. Chair, or go on to the next resolution? You're muted.
Thank you. I would invite you to continue.
Okay.
Through
Thank you. Item number 14, also a resolution on page 21 in your package, additional full-time personal support worker positions. I'll read the recommendation that the Health Committee recommend to County Council that the full-time PSW complement is increased by 3 positions at Bonnashire Manor and 8 positions at Miramichi Lodge, and implemented as soon as possible at an annual estimated cost of $8,570 for Bonnashire Manor and $30,799 for Miramichi Lodge, and further that the F&A Committee be so advised. The background is there, but I thought perhaps what might be the easiest if we ask committee to turn to Appendix 9, which is on page 54 of your package. And it might be the easiest way if I just walk you through the business case itself. So if we look at the background, we know that personal support workers are integral to long-term care. In fact, the background, I would say. We also know at the same time that increased full-time positions allow for better resident care continuity. So in other words, there's less people working, but they're working more hours. And then for the staff itself, it's more stable working conditions, which include benefits. And then specifically relates to COVID right now, but we know as a best practice pre-COVID and certainly going forward is anytime that we can reduce the number of staff who work at multiple part-time jobs, that's going to help us not just as a society, but as an employer and in terms of safety for our residents, for infection control moving forward, whether it's, the plain Jane influenza or, the pandemic that we find ourselves in now. We have, as you know, through your support, reiterated the risk of part-time staff working in more for more than one employer. And in fact, with your approval, we have made that direction to our staff. And so that is currently in place. And on one hand, that's excellent in terms of infection prevention and control, but it does limit us. So for example, if we had a part-time position, a vacant part-time position posted today, PSWs that are out in the community currently working somewhere can't apply for that job unless they give up their existing job. And so that's a challenge in terms of our current recruitment and the vacant positions that we find ourselves with at this time. And so that leaves us, when we have vacant positions, it means when we're posting our schedule every 2 weeks, we're actually posting a schedule with shifts that are unfilled, even though we've tried to fill them pre-posting, post-posting, we call out, we try to fill them at regular time. If we're not successful, we try it overtime. And if we're not successful, we work short. So definitely impacting direct resident care. As well, more full-time positions under the discussion piece will assist with not only recruitment, but retainment, because we know some people leave for full-time jobs by providing a more stable complement. I wanted to move then to page 55, which shows you our current state. And so Bonnechere Manor currently has I'll just use the percentages. We have 30% full-time and 70% part-time, whereas Miramichi Lodge has 17% full-time and 83% part-time. So we are starting from different positions. We know the provincial average is 41%. It's not necessarily a best practice, but it is the provincial average. We know the best practice would be even higher than that. So what I'm proposing and the difference between the numbers for each of the homes has to do with where we're currently at in recognition that there isn't an unlimited supply of PSW. So for example, I'd love to bring Miramichi Lodge up to 33% in one fell swoop as well. But I also have to be cognizant of the current part-time staff that we have, and we want to retain them. And we're able to create the full-time positions that I'm proposing from the bank of part-time hours that are currently unfilled. So I don't want to jeopardize our current staff either. So that's the rationale for moving for those various numbers between 3 for Bonnechere Manor and 8 for Miramichi Lodge. And then if we could move to the financial considerations that are found on page 56 of your package. So the cost is for this budget year, which of course is fairly short, a little over $1,000 for the manor and a little over $5,000 for the lodge. However, I wanted you to be aware of the annual cost, but there is a caveat there. In discussions with Mr. Foss, we agreed that we were going to show you our maximum liability, which is consistent with the QP contract, which is that full-time staff are eligible for up to 18 paid sick leave days per year. We don't budget that. And so this amount is not what you will see in the 2020 budget, because we only budget somewhere between 5 to 6 days. But it is the maximum liability. So I did want full disclosure on that. Saying that for the manor, it would be 8,570, for the lodge higher because we're proposing a greater number of positions, 30,799. And that's it for the two resolutions. Next, Mr. Chair, we have the addendum. If you want to move to that, then, or did you want to go back and review the previous items?
No, we'll conclude with item number 15, which is the addendum.
Sorry, Mr. Chair, you're not muted, but I can't hear you. Oh.
Can you hear me now?
Not great.
Nothing?
Something, so
All right, I'll try that. Is that
that's better.
Okay, I do apologize for having to black out my screen. Electronic activities and machine all over the counter. No, if you would continue, please, Ms. Sheedy, conclude item number 15 on the addendum that was distributed to committee yesterday.
Thank you very much, Mr. Chair. So yes, there was an addendum. I think the chair was taking bets on whether we could get by a month without an addendum, and I lost. So we did get a direction from our acting medical officer of health, Dr. Cushman. It was sent out late on the evening of October the 8th. So it is attached to you. So I'll walk you through the three items. Number one, as it relates to short stay absences, you will recall that the provincial, there was no provincial qualification on why residents could leave the facilities. And so Dr. Cushman has decided that given the increase in risk in Renfrew County and surrounding areas like Ottawa, that it wouldn't make sense that residents would be going out for non-required appointments, medical appointments, those kinds of things. He has left it with the homes to oversee that. And I can't emphasize enough the cooperation that we had from our family members and residents, considering they were only made aware of this Friday morning. And I'm sure many of them had plans related to the Thanksgiving long weekend. And I can tell you, I do monitor our census over the weekends, and there was nobody that went out unless it was to the hospital and those kinds of things. So it's very nice to see that everyone in our community is on the same page in terms of, as our chair and our premier has said, trying to create that iron ring around our residents, but also achieve that balance of, certainly facilitating visits, but not going to those high risk areas out in the community. The second is limiting general visitors. So you may recall from last month, there's a designation by the province of essential visitors and then general visitors. There was no cap on general visitors. Dr. Cushman has asked to cap it to 2 that are designated for a month at a time. So let's say 2 for the month of October, and then come November, the resident can designate either the same ones or different ones. So that is in play now as well. And then finally, as you know, the County of Renfrew homes are requiring for the visits that are happening outside of the home, the absences, in addition to the provincial requirement of visits that happen inside the home, that we have proof of a negative COVID test. The health unit has experienced an increased demand for this, no doubt related to everything that's going on in the community, in addition to school opening, et cetera. And so they have asked the homes to assist our families if they perhaps don't have access to a computer and able to go on the website and get that confirmation. And so we have been doing that for a couple of weeks now, and it had to date has not been a challenge, given that our family members have to call in to pre-schedule the appointment. So it's easy for us to bring up their information on the website if they ask us to, and make that confirmation at that time, because we can't schedule the visit unless we have it anyways. And so that, Mr. Chair, concludes the addendum and the full report. Thank you.
All right, thank you very much, Ms. Sheedy. I have both my audio and the video. If my audio becomes unstable,
Mr. Chair, your volume is an issue again.
Okay. Unfortunately, this is the only solution to that, although that might make everyone's day free. With that then, committee, we are going to go back to item number 5 on the long-term care report, temporary enhancement of personal support worker wages. Any questions, comments? Item number 6, the national standards for long-term care. Item 7, the new operating model for Ontario Health. Item 8, the streamlined long-term care home inspection reports. Item 9, the critical funding priorities, advantages fall pre-budget submission. I just had one comment in the very first paragraph when they're talking about the funding. Immediately it popped into my mind CMI, that is the case mix index, which we talk about every year at budget time and probably about 3 or 4 more times outside of budget time. And that though we are only 20 years now into this millennium, it is a millennium old discussion that we are not adequately funding the care in our long-term care homes. It is providing a significant challenge to that C in long-term care. We've been stuck under 4 hours. The 4 hours has been identified for a long time now, that it is desperately overdue, and no more so needed than now in the time of the COVID pandemic. Item 10, the resolution from the Township of North Glengarry. Item 11, Bunisher Manor, the World War II veteran recognized, and thank you for bringing some joy actually to our committee meeting today. Councillor Rigueur, please. Oh, my mistake. I thought I had seen you. Perhaps like me, it is a fly that seems to be bothering me here. Anyway, thank you once again, Ms. Sheedy, for this. That is this woman's the life that she has led has been incredible, and that she now has to go through COVID-19 is terribly unfortunate after all that she has contributed to our country. Item 12, fundraising. The resolutions. Can I have a mover on the reallocation of the capital budget? Councillor Lafreniere, seconded by Councillor Murphy. Discussion. All in favor? That is carried. Thank you. Can I have a mover on the additional full-time personal support worker positions, please? Councillor Doncaster, seconded by Councillor Rigueur. Discussion. Just one question, Ms. Sheedy, you had thoroughly explained if the practice at budget is not to budget for the full complement of 6 days. I am at a loss to understand why in this instance we are essentially budgeting for, or at least projecting for that.
Thank you, Mr. Chair. Sorry, were you done your question?
I was.
Okay. Thank you, Mr. Chair. Yes, it was a bit of a debate between me and Mr. Foss. Let's say he won. So it was full disclosure, like I said, so that you would know the maximum liability, but that's why I went to great pains to point out that that is not how we budget.
All right, thank you. And of course, it just reiterates that at the time of the budget, we're not budgeting for the maximum liability. In any event, the motion it has been moved and seconded. Any further comment or discussion? All in favor? That is carried. Thank you. And moving on to item number 15, the letter of Dr. Cushman. Councillor Doncaster, then Warden Robinson.
Thank you, Mr. Chair. Not specifically on the letter, but around long-term care visits. Are visitors allowed to bring materials in when they visit? And more specifically, are they allowed to bring food into their family member? Thank you.
Thank you, Councillor Doncaster. Yes, the short answer, depending upon the material, if it is something that we can wipe down with a disinfectant wipe, let's say a plant vase pot, we would do that. If it was something like clothing, for example, we quarantine it. I believe it's for 48 hours. So we accept it and we place it actually between our front and the foyer. So it doesn't actually come into the home per se until that quarantine period is up, and then it's taken to the resident. Specifically as it relates to food, again, as long as it's in a container that we can wipe down, then yes, that is permitted.
Thank you.
Thank you. Warden Robinson.
Thank you, Chair. And I'm referring to item number 3 in the letter from Dr. Cushman. So I'm going to choose my words very carefully here. I'm troubled with the content of this. You know, we know what happened in wave 1 of COVID-19. You know, the demands on long-term care across this province and in our county were extreme. And, you know, we had a lot of staff that had stress and the demands on like never before in their careers. And we made it through. Suggesting now that our staff have time to not only hunt down the results of a test for a family member, but maybe start considering testing for visitors, concerns me greatly. I believe that that is the responsibility of public health to do the testing and provide results to residents. Just last month, we as a committee and as county council agreed to a business case to hire additional staff. They were screening positions because our staff did not have time to do screening as well as the care of our residents. And now we see here that public health expects us to find person's test for them. And if not, if we can't find the test, again, consider letting them provide us with an attestation, excuse me, which I believe last month we said was not acceptable, and that was directed by the health unit as well. I'm not sure if the public health has a purview of directing what our staff will do within our facility that we fund, but I would suggest that what is considered under item number 3 has been since day 1 a public health responsibility, and now somehow has become the responsibility of our staff at our long-term care facilities. So I do think that we require some clarification as to the extent of the reach of public health. I certainly understand that they are inundated with phone calls all the time. I get that. And I know they're working very, very hard to try to respond to everybody as quickly as possible. And a lot of that, which is out of their hands. And I would 100% support the public health and in particular Renfrew County and District Health Unit getting additional funding to hire additional staff to deal with this onslaught. I am not very comfortable in this responsibility being shifted to our long-term care facilities. And I also note that the letter, which is addressed to long-term care and retirement homes, however, item number 3 is just long-term care homes that are going to have to do this. So with all of that being said, I would be interested in the comments of other committee members. And what I am hoping is that I receive direction from this committee to reach out to public health for some clarification and understanding about how this is suddenly our problem. Thank you, Chair.
Thank you, Madam Warden. Councillor Murphy. I'm assuming it's related to what Warden Robinson was discussing. If not, then we'll hold it in abeyance because Warden Robinson had put forward a request at this point. Is it related to the warden's comments? All right, carry on then, please.
Thank you, Mr. Chair. And thank you to Warden Robinson. when I read this yesterday, I sort of read it as a recommendation, like, you know, if you're finding that you're not getting the results that you want from the health unit, this is an option. Now that I reread it, I totally and completely agree with you. This is an overreach. So I think perhaps if you're looking for support to send a letter, I would support that 100%.
All right, thank you, Councillor Murphy. I don't know if there was any clarity being sought there, Warden Robinson. I would invite Ms. Sheedy. I do know that, I would opine that the tests probably are still eligible to be completed at the assessment centers. Perhaps Chief Nolan can weigh in on that. I don't know that the expectation is that the tests are being done at the long-term care homes, but perhaps you can shed some light on that, Ms. Sheedy.
Yes, certainly. Thank you, Mr. Chair. And first off, thank you to the warden for her remarks, genuinely out of concern for our staff. It's very much appreciated. With respect to confirming the negative result, at this time, and I'm knocking on wood, thank God we haven't had a resident outbreak. And so we are able to manage. If that were to change, you know, whether through an outbreak or something else, then I would agree with you that it's not our direct role. We're you know, wanting to be good partners in healthcare and assist where we can. And at this time, as I've said, it's going okay, but I certainly will identify to you if that changes. On the second piece, with respect to long-term care testing family members, I was very clear with the health unit that we would not do this. That is something from a staff resource we cannot do. We, as I mentioned earlier, with the surveillance testing of 250 staff in each home, we spend every second week doing that testing over the course of a week. And then you get a week's reprieve and then it's time to start it again. And so there's no way we could accommodate family members, but more importantly, we're not legislated nor funded to do that. And so I think that is a definite overreach. You know, I would suggest that we could have that conversation with Dr. Cushman directly. And, you know, perhaps he may want to issue an update to all of the players on this, but whatever committee decides. Thank you.
And thank you for that, Ms. Sheedy. Perhaps to provide a supplementary letter that might provide a little bit more clarity, because certainly that was the suggestion in the final sentence of that final paragraph. The other thing that I would suggest is an overreach also is the very first sentence is not supported by any statute or regulation, whatever. It is not the responsibility of the home to assist visitors. Where possible and where readily achievable, I think that some assistance could be provided, but that is not the responsibility, just as Dr. Cushman has identified on the emergency calls. It is not the responsibility of public health also to notify those with negative cases. However, as I understand, I understand that the results are manually entered into a database, so that's to be confirmed. That if that requires perhaps some upstaffing at another agency, perhaps that's a more appropriate means. But I want to be clear that it is not, I repeat, not our responsibility to do the tests, nor is it our responsibility to assist visitors to find their test results. I would remind the committee that the decision that council made was in the interest of the safety and security of staff and residents, that we would be setting aside the option for an attestation of a negative result in favor of a documentation of a negative result. And from that, it is my estimation that the onus is on that visitor to provide said documentation. Where possible, where readily achievable. I think that we can work with the family members, caregivers, et cetera, of our long-term care residents. But I think that would definitely be in support of your suggestion of writing a letter to Dr. Cushman seeking clarity on that. Anything further from certainly Warden Robinson?
Thank you very much, Chair. So listening to the comments, what I would like to do is perhaps with direction from committee is to send an email to Dr. Cushman outlining some of our concerns and requesting that following our EOC meeting on Monday, that he remain on and have a conversation with yourself, the CAO, and Shelley and Chief Nolan and myself.
I would suggest that probably is an appropriate means. We are in different times, and I think that if we can expedite perhaps a process so that everyone is on the same page and rowing in the same direction, the most efficient means of doing that is probably advisable. Mr. Morrow.
Chair, thank you. Through you to the warden. I'm just wondering, and I'm not certain of this, but just in terms of it coming from elected officials, I'm wondering if the correspondence should go to the chair of the Board of Health. Dr. Cushman is an employee of the board, and I'm just wondering if that is the more appropriate kind of chain of command to follow.
I don't know the answer to that. I don't see where the Board of Health is mentioned in this letter at all. I will certainly send the letter to whomever you would like me to send it to, but on Monday, I would like to be having a conversation with the acting medical officer of health.
I think that perhaps I will be Solomonic here without a scythe and suggest that the meeting on Monday is advisable, but I think that there is merit in Mr. Morrow's suggestion that Dr. Cushman is certainly the senior most staff reporting to the Board of Health, but I think since this concern is raised here by the committee of the Council of Renfrew, the Health Committee, that it is appropriate that our concerns are expressed through to the chair of the board for the board's consideration as well. I think that would be appropriate. Anything further? So are we seeking then a formal direction, Mr. Morrow? Okay. Can I have let me step back. Again, Mr. Morrow, you were most helpful in crafting the direction previously. I wonder if you might just on the spot create one again for us.
Sure, that the Health Committee directs the warden to prepare a email correspondence to the Board of Health and with a copy to the Medical Officer of Health, expressing concerns with the October 8th directive, specifically the direction with respect to long-term care and the requirement of long-term care facilities to find or provide test results to family members. And further, that staff be directed to communicate with Dr. Cushman, and that ask him to be prepared to meet with the warden and representatives of the County of Renfrew following the EOC meeting on Monday, whatever that date would be.
Thank you, Mr. Morrow. Warden Robinson does that. Murphy does that.
Chair, I only heard Warden Robinson. Other than that, I didn't hear what you said, but I'm going to assume you're asking me if I am content with that direction. I'm assuming that's what you're asking me, and I'm absolutely fine with it. So thank you.
All right, thank you. If I can be heard, Councilor Murphy as the seconder, as the second commenter on that, does that capture your concerns?
We can't hear you, Michael.
Yeah,
that, as the second commenter, Councilor Murphy, does that also capture your concern? Thank you. With that, then, can I have a mover, please? On the direction, Councillor Murphy, seconded by Councillor Love. Any further discussion? All in favor? That is carried. Thank you. I believe that concludes all items of what was distributed to committee. Just bear with me. Is there any administration report, Mr. Morrow?
No, Chair, thank you.
Thank you. There are no Board of Health minutes. Under new business, there was an item of new business, and for the life of me, I can't remember what it was.
Mr. Chair,
Mr.
I think you need a confirmation of the long-term care report.
Oh, you are absolutely correct. Can I have a motion on the long-term care report as a whole? Councillor Bennett, seconded by Councillor Grills. Once more, any further comments? All in favor? That is carried. Thank you. With that, I will return to new business. Mr. Morrow, please tweak the chair's memory.
Thank you, Chair. This item is a motion for County Council to move the timing of the next Health Committee that is scheduled for November 9th, and that you rightly pointed out that it conflicts with the EOC call that day. And what staff are proposing is that the Health Committee be moved to 1 p.m. on the Thursday following Finance and Administration Committee, so that we do not have to reschedule the EOC call that is planned for the morning of November 9th. The challenge with that week is it's also Remembrance Day, so it caused us to shift a couple committees around. So I believe that will alleviate that problem if we make that recommendation to County Council to reschedule that meeting.
Thank you, Mr. Morrow. And of course, I was predicated initially on Wednesday, which would be the day of Health Committee. So it was intended to be moved. Now it is being proposed for the Thursday afternoon as opposed to Monday, correct?
Correct, sir.
Okay, thank you. Warden Robinson, do you wish to speak to this or move that?
I just wish to speak to it, please. So that means we will be following finance. So is that an issue with whether or not we needed to bring something to finance?
At this point in time, I'm not aware that there's anything to be brought to finance, so we'll have to plan for that when we prepare reports.
All right, thank you. Any further, we will, okay, Councillor Frenier, please.
So that, I just want to confirm the date then. So then the meeting would be October 29th at 1 p.m.?
No, thank you for that question. Chair, through you, Councillor Frenier, it would be November 12th at 1 p.m.
Okay, thank you for clarification. November 12th at 1 p.m.
Correct.
Thank you. As a new business item, perhaps, then just seek a resolution that the next meeting of the Health Committee be held on Thursday, November 12th, 2020 at 1 p.m. Can I have a mover? Councillor Frenier, seconded by Councillor Bennett. All in favor? That is carried. So that will amend then item number 10, which still indicates the initial reallocation to the 9th. It is in fact now on the 12th of November. With that then, we are concluded. I would seek a motion to adjourn. Councillor Murphy, second Councillor Regier. All in favor? That is carried. Good to see you. Glad to be able to be here briefly. Thank you, everyone, for your attention to this morning's meeting and for your participation. Have a